What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. In today's video, we're covering ethical considerations while doing x-rays. So, this one in particular, we're covering not ethics as far as standards of x-ray, but ethics as far as people's, culture ethic. That's kind of where we're covering. So, the few times I've encountered this was a few times when I was a student and then a few times while being a tech. Usually, most, I would say, average Americans, usually don't have many, they're kind of okay with either man or female doing their x-rays. They don't really have a preference. Most of the time, most average Americans are okay. It's kind of like when you get into the niche cultures, or even sometimes, I wouldn't classify even taking out Americans, because there's certain times, let's say if there's a hip, or there's a pelvis, or there's a chest x-ray, and you have to remove some artifacts, and let's say that's a lady. If there is a lady tech, you would kind of want, sometimes the patient would be more comfortable if the lady tech were to remove the bra, were to perform these stuff, because it is more lady stuff type. I see that a little bit more compared to the other niche situations. So on the other spectrums, I've noticed that there's certain religions, or not religions, but certain you have religions too, but certain cultures where, and I've had this one encounter with I think it was some kind of Asian person, where we would be talking to them and they wouldn't make eye contact, so they would be looking down. They would answer everything, but they would just wouldn't be making eye contact. So I've noticed that a few times. Other times they would I think one time it was with an Indian or Arab. I can't remember. It's been when I was a student, where they specifically requested a female tech to do their exam. Which, I mean, when you can, you would do that, especially in daytime when you have more techs. You could, wouldn't be a problem. Sometimes at night, when it's just two dude techs and that's all you got, the best situation you could have is maybe grab a nurse, lady nurse, be there while you do said exam, because sometimes there is no female or male tech. It's either one or the other. So certain situations you may have to work around them. You'll have to explain to them. So in those situations where they want a female tech, there's not a female tech, I would grab a nurse or get the doctor or whoever and kind of explain to them what we're doing, how we're doing, and then kind of let them judge based off of if they want to do it or not. What other situations have we had? There's been a few patients that came to the hospital. I can't remember what ethnicity or what they were, and they refused the x-ray because of the technological, something with technology, that they didn't want to use it to cure them, so they just wanted the pain medicine, but they didn't want the radiation use. I don't know, that was kind of weird, and they weren't even old. I understand older people don't like to use technology and all that to help them, but I don't know, it's kind of weird, that situation. That happened one time. What other? I guess the whole genders, those two, I won't get into details, but especially you have to be careful with them, or whatever they identify as. Most hospitals have done better job to where it'll spawn in the name. It'll be it'll be the name, their government name, and then in parentheses it'll be their other name they use, and in the details it'll be is a male, but identifies as female, like certain little niche things that will help. Because if you disrespect anyone, especially their gender, most of the time they're not happy. So most of the time, for those situations, kind of go with the neutral, hey, how you doing, buddy? Like, kind of like, hey, kind of mid situation. But most of the time, for most people, you really don't fall into the diversity, like the situations where you'll need specific things. Well, most of the time you won't. It's very, very niche situations that will happen. And even sometimes when those situations happen, sometimes it's like with older people, and sometimes you'll have like a younger person with them, and they'll be like, hey, yo, bro. So because of my family members, this and that, they're going to want certain stuff to happen. And yeah, it's been your boy, Tech. See you on the next one.